really why I make these videos is because like a lot of my patients have problems where they've been to a doctor, they've had a diagnosis of sorts, and like they're left with these symptoms to just basically manage. There's nothing that Western medicine can find wrong with you. So if that's you, then hopefully the videos I make will be helpful for you. And yeah, I guess with acupuncture, like there's lots of things where we would see a connection between problems in the body, where Western medicine doesn't see that connection. Also, the thing I was talking about at the start, like I'm going to talk about the AHPRA situation in Australia. And if this is boring for you, you can just turn it off. But yeah, I think it's important to talk about it because it's something that's affecting our practice in Australia. And while it doesn't affect our practice, like how we practice directly, it affects how we can advertise to people. So what's happened is some laws been passed last year for, going back, let's just go back a few years. So Chinese medicine and acupuncture is a registered health profession in Australia, which means the government registers practitioners. So there's a protection of title, not a protection of practice. Protection of title means that the person, a person can't use that title, but they could still use that practice, which is really hard for the public sometimes. So some of my patients say, well, I had dry needling, and I had a patient the other day that told me I had dry needling, and the dry needler told me that it was pretty much the same as acupuncture, and it was not. Like when they described to me what's happened, I said, that's nothing like acupuncture. That's a whole nother concept. What is dry needling? Yeah, so we won't go into that because I might get really angry, and I don't want to do that right now, or just passionate. So the laws in that regulate practice in Australia are good in a way because they're designed to help protect the patients, protect people like yourself that are making a decision about your healthcare. But what it means is that they've said we can't talk about the treatment of terms like particular healthcare problems unless there's what they would deem sufficient evidence to back up those claims. Now, what is sufficient evidence? And if you want to verify any of this stuff, you can go onto the AHPRA website, ahpra.gov.au, and look up Chinese Medicine Board, and you'll see all the registered Chinese medicine practitioners and whatnot like that. Look, some of this, in theory, it's a good idea. I think it's a good idea. But in practice, for Chinese medicine, it doesn't fit the Western medicine model that they're trying to squeeze it into. There's some practitioners that would like it to treat, would like it to be like that. But there's some practitioners that still practice in a classical or a traditional way, like myself, that the diagnosis that we make and the treatments that we come up with, they're not based on like woo-woo or some pulling this formula out of the air or something like that. But they're not based on a research project. They're not based on like the latest. So AHPRA wants us to only make claims based on the latest 5 years of evidence in a Western medicine sense. Now, the problems arise in a couple of ways. One is that in a research project, you get a whole bunch of people with a common ailment or a common symptom or a common disease, and you give them all the same treatment because you want to minimize the variables. So variables are things that change in the dynamic. So if I had 100 patients with headaches and I give them all individual treatments, there's no way to really test whether that treatment was effective or not. So in a research project, they either choose an ailment, so treating something like nausea or pain would be easy to apply that research model, or easier to apply it to. But often what we do in the clinic isn't replicating that situation. So for instance, a patient will come in and they'll say, oh, I've got a headache and I'm trying to get pregnant and I've got diarrhea and I've got, oh, and by the way, I had a divorce 3 years ago and I've never been the same since and I always get common colds or something like that. Now that's all completely made up. would be a typical situation. And so there's lots of things going on there. What do we treat first? Do we treat them all those things at once? Which things do we focus on? And that's really an individualized situation. Depends on how the practitioner's trained as to which way they do that. So these laws requiring practitioners to only advertise according to what a research project shows it can treat, and by shows they mean like it's got to be the gold standard, which is the double blind placebo-controlled trial. And there's nothing wrong with that model for a Western medicine intervention. You've got 100 patients with cancer, you give them all the same chemotherapy treatment, or you give them all the same surgery, and you check the outcomes, and that's a great way to measure it. But for Chinese medicine, it's not a great way to measure it, because we don't treat people like that. We treat people as an individual. And this may sound funny because, or not funny, but it may sound like, oh, well, it's just, you just want to, pick a treatment out of the sky, and how do you know what treatment to give people? That's a really good question, and that's one of the reasons why I retrained in the style of herbs that I do, because I was finding that, well, it's not until I started training in this style of herbs that I realised what I was doing before wasn't as systematic and as systematic. Like there's an actual approach to exactly what you're going to do. And look, there are those approaches for what we would call TCM, like just stock standard Chinese medicine people. But anyway, that's a whole another rant. So I sort of intended this video to be a bit of a rant and a bit of an update about that, because I think people need the public need to know. So at the end of the day, at the average Joes on Facebook, they're scrolling through and they get an ad saying, have you got anxiety? This could help you. We cannot say that anymore with acupuncture. We cannot say, unless you've got a research project to back up what you're doing. We can't target those, and that can be good in a way, because it's less misleading for people. But there's lots of things where patients will get a result from a treatment, but maybe they don't know they can get that result because we can't now tell them that. So I think just because the research study doesn't come out with a good outcome, that actually doesn't reflect what the outcome will be in clinical practice. So it is a bit of a conundrum. It's a bit of a dilemma, and I mean, in my practice, like marketing wise, I've kind of cut back a whole lot of stuff that we do. Like personally, I was audited by AHPRA, and I had to remove a whole lot of things off of my website, which is fine. I didn't mind that. Just get it done. And I just want to be transparent, because I think the public don't really know about it, and it doesn't mean just because we can't say we can't treat it anymore doesn't mean it doesn't mean that a practitioner can't treat it. So let's say someone rings up a clinic and they want to talk to someone over the phone. We could probably give them more information over the phone about what we can do. And that's not like it's illegal or anything. It's just because it's an individual, it's a one-on-one basis. So we can discuss with you a little bit. We can talk about, your and it's also the AHPRA regulations say that that's okay to give out that advice over the phone to patients, because you've got the opportunity to ask questions and to have a back and forward approach there. So that's a good thing. So I encourage people, if you're not sure, like let's say you want to come and see me as a patient, or even maybe you're not even in Perth, you're just in another country or something. Well, if you're in another country, you don't have to worry about these laws. But if you're in another part of Australia, then you could go to your practitioner and just call them up and ask them, and that's a good thing to do. So I think that Chinese medicine's in an interesting place in Australia. There's a lot of things that we practice. I guess the way practice is being pushed, and I see the way that teaching is being pushed. I mean, I'm a teacher in Chinese medicine as well, is to propagate this love of research, which can be good for some things, but at the same time, there's a lot of the foundations of the classical foundations of of practice that maybe students aren't being taught, because obviously time, you've only got a certain amount of time to actually teach a person. So, you know, in the favour of, so there's a lot of favour of research, and look, that can be good in terms of outcomes and more projects being done because more students know how to do research. But I think the beauty of Chinese medicine, where it lies, is in primarily in diagnosing through the pulse. That is something that only Chinese medicine does. It's not part of really other systems, not mainstream systems of medicine. And that's something that I've decided to focus on in my practice more and more, rather than getting caught up in other ideas and other things. So I just want to give you that update about where things are at. And I want to produce more and more of these videos, because like, I know that I can explain Chinese medicine quite well for people, but at the same time, I just need to make it clear that I don't want to mislead people. So I'm basically making my videos about educational situations for yourself, like self-help things, and then you can take away from that what you will. And so I hope that it helps you. And if you've got particular things that you'd like me to talk about, like how you can look at different things, or how Chinese medicine approaches different things, then please leave a note in the comments. I love getting the comments and seeing if this is helpful for you, because I don't want to waste my time banging away with stuff that's not helpful for people. So if you've got a comment, that'd be great. You could leave it in there. And hopefully having a great day, and be well.